This is really tragic, and so we are still understanding and trying to understand why patients are dying from vaping. As best as we can tell, the lungs are getting inflamed, and the inflammation is severe in these patients. Most patients who have presented to the hospital nationwide with vaping have ended up in the intensive care unit on some kind of a life support. So a few of them have then died. Most of them have survived, but it is unfortunate that some people die from this. And this is really because the lungs are severely inflamed, and we call this condition acute lung injury, or ARDS, acute respiratory distress syndrome. That's really how they die from it. Generally speaking, yes, you do not want to smoke cigarettes or actually vape for that matter in front of children, or for that matter for yourself. And certainly infants or children who are exposed to these kinds of smoke can suffer adverse consequences in their lungs potentially. So we do not know, but I would advise extreme caution in any parent doing that in front of their children.
Does there need to be an illegal substance in these cartridges, in these vaping devices, in order for someone to die?
That's a great question. The short answer is we do not know. What the CDC is reporting, and certainly what we are seeing, is that a number of patients are expressing that they've actually used THC or marijuana containing a vape. Some of them have said that they purchased this in the black market. Whether that in itself played a role, or is something about the marijuana being vaped that's playing a role, or something about other chemicals in the vape that's playing a role, we do not know, because certainly there are many cases where people have gone on to develop this same problem where they've vaped nicotine. And at this point, I would highly recommend, and that's what the health system would recommend, and my colleagues would recommend, and the CDC recommends, absolutely no vaping until we and the CDC get more information in this investigation. Vaping sort of came around in 2007 or so, but really escalated in the last year or two, and it's become a trend. It started off a few years ago as an attempt to come off tobacco smoking, but there's been so much of a proliferation that it's affecting teens, high schoolers, middle schoolers, and also, you know, we do not know the source of the product, so there's so many factors involved. There's certainly been an explosion in vaping, and so how much of this lung injury is a result of that explosion in vaping, how much of that is from different substances, we really do not know, and that's the investigation the CDC and the FDA are conducting right now. The patients we've come across have all started vaping in the last few weeks to a few months prior to presentation. One of them who already had lung disease told us that the vaping happened just one day before admission to the intensive care unit. So it's pretty dramatic.